Good morning, everybody. It's Dr. Bertolino from Smooth Solutions Medical Aesthetics. Today we're going to do a kind of an older procedure with PRP, but we're going to use a system that gets more platelets and better platelets with our PureSpin centrifuge, and we're going to give you a little glimpse of it, and we hope you enjoy it. So stay tuned. So we're back with my aesthetician / nurse, Kristen, and as you can see from her arm, we already took some blood and we spun it for 1 minute in our PureSpin centrifuge. You have to remember what I tell everybody. It is the centrifuge that makes the difference in the outcome and as far as the quality of the platelets. So when you're looking to have a P shot, O shot, vampire facial, vampire facelift, any PRP procedure, it's the centrifuge that you should be focusing on. And let me show you now what we have accomplished with our first spin. And you can see these tubes are new, so we have spun down 30 cc's of blood in our first spin. We're going to now go on to our second spin, and we'll show you from there. Just hang on.
Go ahead.
So what I'm doing now is I'm drawing up the yellow stuff, and you're going to see that come into the test tube, into the syringe. Here it comes. And with it, we're going to get a flash of red. That's going to be the sweet spot. And I've done this for a long time. It's just that these tubes are different now, and we can get better quality platelets with these new tubes. So we want to show you. So you can see I'm drawing up. And now I'm going to get a flash, there it is, of red cells, or platelets. This is what we are now going to spin. So now what we're going to do is put our plasma on the underside of this tube, like this. Okay. So now we're going to weigh it because it is a centrifuge, correct? And it's balance, counterbalance. So there's our product. And we're going to balance it against water, correct? Which is just about the same. So now we have a balance, counterbalance. Now I'm going to take this and I'm going to put it in the centrifuge, and I'm going to cap initially 1 minute. Now we're going to do 3 minutes at 4,400 RPM. So here we go. We'll show you that in a minute. I'll show this. Tell me where we're drawing from. Yes. So here we are after our second spin, and we did a full 3 minutes at 4,400 RPMs. And you can see the buffy coat down there, which is the real important part of all this, right? And the rest of the plasma. Now I'm going to draw off the sweet spot that we're going to use, which you'll see in a minute. So now I'm drawing off. And I'm going to leave about 3 mLs in there. There's 15 milliliters in there. I'm drawing off enough, as you can see, till about that 3 mark. And we'll show you in a minute what else we got.
Swirl it.
So with that little bit I had left after I took the top off, you can see now I'm making some Kool-Aid, and that's the sweet stuff. All right, and this is the injection right here. Now this you won't get with any other company, okay? Here is the sweet stuff. This is very high quality platelets. And what we can do with this portion is we can heat it like we've been doing with AutoCore, make it into a gel. We're not doing that today. And then incorporate this into the gel and inject it. Today we're just going to inject, just like a vampire facial or facelift, just this nice amount of Kool-Aid. You'll see it in a minute. So what is this? This is VAMP, salmon sperm DNA. Yes, we've been using it a lot lately. What are we going to do with it? We're going to take a portion of it and mix it. And as you see, it looks like a regular filler. We're going to take a portion of it and mix it just to show you with the platelets, kind of like a vampire facelift where you're mixing platelets and filler, but we're going to be a little bit more interesting today. And we're going to take a little lure lock, and we're going to take some of this, not all of it, because we want to put some on topically. So you can see I'm injecting maybe half the syringe into there, okay? And now what I'm going to do is I'm going to get another syringe, and I'm going to mix it, kind of like this. Get it? And we're going to use this. In fact, I'm going to use this syringe now to start, and we're going to use a cannula, because cannulas are nice. They're atraumatic, and a cannula, soft fill cannula, as you can see, is blunted, so it's not a shearing force going into the face. We do have to make a hole, and we have a little thing to make a hole with, so we're going to do that first. And I always like to measure just a bit, and then make a little hole, maybe right here. And we'll show you in a second what I'm doing. So I decided to mix the VAMP entirely in the syringes instead of putting it on topically. So the VAMP now is mixed, and you can see the cannula itself is very thin. And now we're going to apply. I'm going to take the little pin out, and a very, very small hole, and we're going to thread. You okay?
Mm-hmm. I'm fine.
Now, what I want you guys to know is what I learned. There's an artery here. Whenever you inject any kind of filler, or anybody does it to your nasolabial fold, make sure you block it, because you don't want to put any... Blood is one thing, but filler is another. You don't want to get any filler in there. And then it's just a simple application that we're doing in her nasolabial fold. And we want to come around, maybe do a little bit of her lip there. As you can see, that's not very difficult to do. And then just a little smoothing, maybe with some ultrasound gel. And now I'm going to go to the other side. Here we go again, and a little pin that goes into the face, makes our channel, and then in a second we're going to take the pin out and probably going to put a little more in her under eye here because she has no volume there. And we take this out, leave that right there, or there, and then thread if we can. Sometimes it slips. There it is. Little bit of pressure. There we are. We're in. You okay?
I'm fine.
Remember to block when you put any kind of regular filler in, and then with the cannula, just inject. And I put a little bit over here by her, where her smoker's lines would be. And you can see how that fills that.
There you go.
Now we're going to put some in her mid-face. So in order to do that, we want to do it simply. We're going to come in from around here. And this is a tiny, she's been numbed already, just so you know. And we're going to put it around in the mid-face and then another one on that side. And then we're going to show you. But here's the thing. This now doesn't sting anymore. Years ago, when I first started doing this, if you put it under the eye or something, it swelled and it was just terrible because of the PRP. Now they've made it different. So this is completely without any discomfort. Okay, now we'll just show in a minute. Thread up. Remember, this is blunted. We can't do any damage. We're right over here, and we're going to apply where she has some lack of volume in the mid-face. And this is going to do a very beautiful contouring of the cheek. And you can see the difference side to side. I think it makes all the difference in a person's look as they age, along with the tear troughs. This is a very good treatment for tear troughs because you won't get any swelling. Nasolabial folds, chin, mandible, even some of the hollows in here. So we're going to finish her off by finishing the mid-face. Remember, we have some VAMP in there, which is salmon sperm DNA, and we've mixed it with a more highly produced amount of platelets, a more enriched platelet, compared to the other companies that just sell you kits. Remember, it is the centrifuge that makes all the difference. And as you can see, she's got some volume now in her face, and we'll clean her up and show you her sitting up in a minute. So you can see a little bit of extra volume in the mid-face, a little bit here. She had no pain. She's going to get a bit of a glow with this, actually, over the next couple of days. As this starts to soften, those sharp nasolabial folds will come in, and this will come up a bit. She won't look like a chipmunk. So, if you're thinking, guys, about doing any kind of PRP treatment with us, come and see us. We're doing some, like I just showed you, a new technique with new tubes and everything with our PureSpin PRP system. This is the way to go, whether you're doing hair, face, or like I like to say, your other head. Come and see us. We want to pump you up.